Hello. Healthcare reform, or better known as Obamacare. Before I start, I would like to say this is actually my fourth time to present this. I have done it on YouTube, and you can't hear it from the background noise. I've done it on McGraw-Hill. We had technical issues, but anyway, not that anybody cares to hear all that, but just FYI. Healthcare Reform Act, or better known as Obamacare. Healthcare innovation is difficult, but yet not rocket scientist, is what a pharmacist, a well-known pharmacist, has quoted. In the United States, we're the only major industrialized nation that does not offer health care to each of its citizens. Healthcare Reform Act was placed into law March 2010. I would like to quote what Stephen King, a congressional Republican representative from the state of Iowa, says. President Obama has dismantled the finest medical system in the world and replaced it with a failed socialist model. What I would like to share with you is today we do have a form of socialized medicine. When you go to your doctor or your mid-level provider, they know drug A is the best drug for you. But yet, in order to cover it through the insurance, they make you go through several tiers of drugs, trying them first, and they're always normally the cheapest drugs. So therefore, your medical doctor says, I really want to give you drug A, but the insurance company says, nope, we won't cover it. Therefore, we're going to try A, B, and C, different tiers, and then we may approve the drug for you. So there is a form for the last 15 years of socialized medicine. Healthcare reform. It will expand Medicare, which is part of Social Security, which we paid into. Most older people draw Social Security, retirement, and they have insurance through Medicare. And it will expand Medicaid. Medicaid is welfare. Either you're not able to work, or whatever the scenario is, and you get Medicaid. And it will increase both. In 2015, we'll have 22 million more citizens covered by health care with this act. Pre-existing medical conditions will be covered. Private business spending will decrease. Personal and government spending will increase. Again, Healthcare Act, the healthcare reform will expand by 2015 at a cost of over $2 trillion. Two-thirds of that will be paid by the government. The balance will be through the private sector. Supply and demand will cause citizens, each of us that have health insurance, will have less out-of-pocket expense. And what we're talking about that is co-pays, deductibles, certain procedures will become where you don't have a co-pay. But the cost of your health care will increase. So that's where they're talking about it will cost us individually more. St. John's trauma stats in Tulsa, Oklahoma, I'm bringing that up to show a form of how it could be paid for. In 2004, there's a trauma fund set up. It is funded through tobacco and alcohol tax. Individuals that come in to the emergency room with gunshot wounds and knives, the majority of them are not covered with insurance, do not have insurance. The hospital then can ask the trauma fund for a partial repayment or partial reimbursement. Now, the other thing that's just more of an interesting fact than anything, the highest penetrating trauma per capita, and that means, again, gunshot wounds and stab knives, is 16% for 2011 for St. John's Medical Center. The national average is between 8 and 9%. So we have more penetrating trauma per capita than Washington, D.C., and that's kind of hard to believe. But they have there was a trauma fund set up for anybody in the state, and if they don't have insurance through alcohol and tobacco tax, you can ask for reimbursement. The bottom line is the taxpayers, we are paying for the uninsured people right now. They go to the ER, they have no way of getting preventive medicine or preventive care like you and I do, and that puts us all at risk. The whole, all the citizens are at risk when some of them don't have preventive care. One way or another, we do pay for our uninsured. In order to pay for this, we currently give $1.5 billion to Egypt. They tell us they don't need our aid. That is one foreign aid that we give. And I'm not saying that we should cut out all foreign aid. What I'm suggesting is that we cut out at least $1 trillion of foreign aid, not all of it, that we're giving to countries that do not respect us. Socialized medicine, we've already addressed because it's here. The Affordable Care Act is expensive, but we're paying for it now, like with the credit card, but we really don't know what the balance is. Whereas if we have this act, then we'll be able to monitor and say, yes, we're spending too much, or no, we're not. We're currently paying for the uninsured through rates, increases, etc. There needs to be, whether it's this act or some other act, there needs to be something in place so that we all can have health care coverage. I don't want to be the individual that has to tell a grandmother or a mother that, oh, by the way, your child cannot have the care that they need. If an individual comes into the emergency room and they're not a U.S. citizen, they're here illegally, they're more apt not to go to the doctor, but they'll run to the ER if their baby is sick. Now you can say, well, they shouldn't be here. Well, it's not that baby's fault that the adults are making poor decisions. On this, we just need to figure out which plan would work and put it in place. I do appreciate your time, and thank you very much.